Peace and blessings, stroke survivors, caregivers, and to all of you. Welcome to Strokes Initiative. My name is Wayne Burns, and I will be bringing you videos about life after having a stroke, among other topics. The videos will be educating and resourceful, not only to the survivors, but to their caregivers as well, and to others who want to learn something about brain damaging conditions. I know you're wondering what makes him an expert on brain damaging conditions. Well, I'm not. I'm not a doctor, nor of any kind of expert about the subject matter. I'm only a determined stroke survivor who refused to give up. I refuse to give up on my life and myself. On November 12th, 2017, I became a survivor. I was diagnosed with having a stroke, and on this day, I decided I wanted to live. I chose to live not only for myself, but for my loved ones. Around 2 a.m. that Sunday morning, I had to use the bathroom. I was feeling kind of strange when I woke up. When I stood up, I felt even more crazy. My head was hurting so bad, I never had this feeling before in my life. I woke up my then fiancée, now wife, to tell her what was going on with me. But at that time, I was having a stroke. I fell back on the bed. My speech started slurring. I could barely move my leg. I could move my arm, but I couldn't move my leg that much. God saved me that day. I was blessed to be alive. God had plans for my life. Enough about me. I could tell my story at a later date. Let me give you some information about our organization. Strokes Initiative is a non-profit organization that Yvonne O'Neill, a 2-time stroke survivor, and myself created for the empowerment of stroke survivors and their caregivers. We wanted to help other survivors deal with the devastation of having a stroke. Dealing with the devastation of having a stroke affects not only the stroke survivor, but their entire family. And the not knowing what to do next should be the least of their worries. Knowledge is power. It is our belief that knowledge power can be healing power. And with the information and resources that we provide, we believe that the healing process can begin. Our mission is to educate and provide stroke survivors and their caregivers the resources and the preventive program towards leading healthier lives. The Strokes and Strokes Initiative, to us, stands for S, strong, T, triumphant, R, resilient, O, optimistic, K, knowledgeable, E, empowered, S, survivors. We are strong, and our strength helped us to survive. And for this, we became triumphant and resilient. We are optimistic in our ability to change course, manage stress levels, eat healthy, and achieve quality of life. We become knowledgeable from the resources and from the access to referral networks that the Strokes Initiative provide to help you become an empowered survivor. My first video, I will explain what is a stroke, the 3 main types of strokes, and what effects they have on your body. What is a stroke? When part of the brain loses its blood supply and the part of the body that the blood-deprived brain cells control stop working. That's deep. That's real deep. Stroke is the 5th leading cause of death in the U.S., with 146,383 deaths a year. That's 5.2% of the population, according to the CDC. People at risk for having a stroke have high blood pressure, high cholesterol, diabetes, and those who smoke. People with heart rhythm disturbance are also at risk. You can prevent a stroke by quitting smoking, controlling your blood pressure, maintaining a healthy weight, eating a healthy diet, and exercises on a regular basis. The prognosis and recovery for a person that have suffered a stroke depends upon the location of the injury of the brain. There are certain personal risk factors for a stroke that you can't control. Stroke risk can be linked to your family history. Stroke risk is higher in some families because of genetic health issues, such as high blood pressure. Sex. According to the CDC, while both women and men can have strokes, they are more common in women than in men in all age groups. Age. The older you are, the more likely you are to have a stroke. Race. Caucasians, Asian Americans, and Hispanics are less likely to have a stroke than African Americans, Alaskan Natives, and American Indians. The next thing I want to talk to you about is the three main types of strokes. The first one being transient ischemic attack, commonly known as TIA. A TIA is when a brief stroke-like attack that, despite resolving within minutes or hours, requires immediate medical attention to distinguish from an actual stroke. Doctors call a TIA a warning sign for future strokes or a mini stroke. Symptoms include weakness of one side of the body, vision problem, slurred speech. The effects are people may experience speech, impaired voice or slurred speech, visual, blurred vision or vision loss, facial, muscle weakness or numbness. Also common, difficulty swallowing, mental confusion, or reduced sensation of touch. The next stroke I would like to talk to you about is ischemic stroke. Ischemic stroke occurs when an artery to the brain is blocked by a blood clot. The brain depends on its arteries to bring fresh blood from the lungs and the heart. Two types of ischemic strokes are: number one is embolic, a blockage of blood supply to part of the brain caused by a clot or debris. Embolic stroke occurs when a blood clot or debris travels from one part of the body and lodges in a narrow brain artery, blocking blood flow to the brain. It is a medical emergency. An estimated 15% of embolic strokes are due to a condition called atrial fibrillation, where your heart beats irregularly. Number two is thrombotic. Thrombotic is an ischemic stroke caused by a clot forming in a blood vessel in your brain. Unlike a TIA, the blood clot that causes an ischemic stroke won't go away without treatment. Symptoms include sudden numbness or weakness of the face, arm, or leg, especially involving one side of the body. Sudden confusion, trouble speaking or understanding, loss of vision in one eye or both, trouble walking, dizziness, loss of balance or coordination, sudden severe headache with no known cause. Effects are: people may experience muscular, difficulty walking, instability, paralysis with weak muscles, problems with coordination, stiff muscles, overactive reflexes, or paralysis of one side of the body. Visual, blurred vision, double vision, sudden visual loss, or temporary loss of vision in one eye. Speech, difficulty speaking, slurred speech, or speech loss, whole body, fatigue, lightheadedness or vertigo, limbs, numbness or weakness, sensory, pins and needles or reduced sensation of touch, facial, muscle weakness or numbness. Also common, difficulty swallowing, headache, inability to understand, mental confusion, or rapid involuntary eye movement. The next stroke I want to talk to you about is the hemorrhagic stroke. That's when a blood vessel in your brain ruptures or breaks, spilling blood in the surrounding tissues. There are two types of hemorrhagic strokes. One is aneurysm, that which causes a portion of the weakened blood vessel to balloon outward and sometimes rupture. Two, arteriovenous malformation involves abnormally formed blood vessels. If such a blood vessel ruptures, it can cause a hemorrhagic stroke. Very high blood pressure can cause weakening of the small blood vessels in the brain, and the result is bleeding in the brain as well. Symptoms can vary based on the location of the hemorrhaging in the brain, but may include numbness or weakness of the face, difficulty speaking, or difficulty walking. Effects. People may experience muscular weakness of one side of the body or paralysis of one side of the body. Also common, bleeding, decreased level of consciousness, altered level of consciousness, difficulty speaking, EKG abnormalities, fainting, headaches, seizure, or sensitivity to light. Earlier in this video, I explained to you that stroke is the 5th leading cause of death in the USA. Well, stroke is the 4th leading cause of death in women in the US. Women have a higher lifetime risk of having a stroke than men. While some stroke signs are the same in women and in men, some are most common in women. Stroke signs that occur more often in women include nausea or vomiting, hallucination, pain, general weakness, shortness of breath or trouble breathing, fainting or losing consciousness, seizures, confusion, disorientation or lack of responsiveness, sudden behavioral change, especially increased agitation. Women are more likely than men to die from a stroke, so it's important to be able to identify a stroke as soon as possible. Stroke is the 5th leading cause of death in men in the U.S. Men are more likely to have a stroke in their younger years than women, but they are less likely to die from it, according to the National Institute of Health. Men and women can have the same signs and symptoms of a stroke, which may involve symptoms that relate to impairment of nerve functions. However, some stroke symptoms occur more often in men, which may include drooping on one side of the face or an uneven smile, slurred speech, difficulty speaking, and trouble understanding other speech, arm weakness or muscle weakness on one side of the body. While some symptoms may differ between men and women, it's equally important for both to be able to spot a stroke early and get help. Remember fast if you think someone might be having a stroke. F. Face drooping. A. Arm weakness. S. Speech difficulty. T. Time to call 911. Don't forget to like this video, and most importantly, don't forget to hit the subscribe button. If you have any questions or comments, feel free to do so in the comment section. Until next time, peace and blessings.